Howdy y'all, in this video I'm going to tell you everything, yes everything you need to know about a colonoscopy. I'm going to go through the most frequent questions people ask me, such as, what is a colonoscopy? Does it hurt? Will I feel anything? Why do I need to do this? Yes, every question you guys have had about a colonoscopy, we're going to answer in today's video. Guys, let's talk about poop. Howdy y'all, Dr. Samir here, aka your poop guru, trying to give you the best tips and tricks to help out with your health. If you haven't already, for goodness sake, smash that like button, like, share, subscribe, and don't forget to turn on those notifications. And don't forget to subscribe to my weekly newsletter where you can get great poop tips just like this one. Colonoscopy, everybody's favorite thing, right? I know you guys are looking so forward to it. I have so many people who ask questions about a colonoscopy because, guys, I am a poop doctor and this is what I do. I want to try and answer the most common questions I get from patients. So question number one, why do we actually do this? Very good question. Well, the reason we want to do a colonoscopy is that colon cancer, unfortunately, is the second leading cause of cancer death in the United States. But it is the most preventable cancer that's out there. And the number one way, the best way to prevent colon cancer is to get a colonoscopy. What we do with the procedures that we put you to sleep, I use a very small camera. We took a look inside of that colon to find precancerous polyps. Polyps are growths that have the potential to go into cancer, and if we don't remove them, they eventually will go into cancer. And so with the colonoscopy, not only can we find what's going on, but at the same time, we can remove those polyps, and by doing that, we can decrease or eliminate your risk for developing colon cancer. This is a very simple test for us to do, and typically we do it at least once every 10 years, which means that if you have a normal colonoscopy, guess what? You're good for 10 years. There is no other test in which you can say that, and there's no other test in which you can also find and remove the problem at the time of the procedure. Question number two, what is the recovery like? It's great. The worst part, unfortunately, is that prep we have to give you the day before, but the day of the procedure, we give you a very effective medication that puts you to sleep very quickly and you wake up very quickly. It is fantastic. It is the best part. It is the best nap you're ever going to have. And typically at the day of the procedure, because we give you sedation, you can't drive, you can't make big decisions. So if you're looking to buy a big TV, that would be the time not to do that. But the following day, you can typically go back to normal activities, do what you want to do, and say that you got your colonoscopy done. Question number three, when do we get the results? We will know at the time of the procedure what is going on, and if we take biopsies, it may take a couple of days or even a week to get those results back. But most of the time, whenever we do the procedure, we are trained to know what is going on, and typically if it is a polyp, we will remove it, and we can usually tell at the time if it's a polyp that's worrisome or a polyp that may not be a big deal. So you'll know right then and there what is going on. Question number four, is it painful? Can you feel the tube? Yes, it is the most painful experience of your life. No, of course not. You are asleep the whole time. You can't feel anything. You don't know what's going on. It ends up being the best nap you ever have. We do insufflate some air inside your colon, but for most of us, we use CO2. And because we use CO2, it dissolves rapidly. So by the time you wake up, the gas is already gone. Now afterwards, you may feel a little bit of gas, a little bit of bloating. You may have to fart, which is perfectly fine because I'm a fart doctor too. But beyond that, most people feel great, and I want to stress you do not feel anything during the procedure, and typically it's not a very painful experience. Next question, hey Dr. Islam, if I feel great, why do we need to do this? Well, that's the whole reason, because I want you to continue to feel great. The problem with precancerous polyps is that they don't cause symptoms until it's too late. So even though you feel great now, you may be having these polyps growing inside your colon and not realizing, and then it may become a point in time where you don't feel so good. When you start to have belly pain, weight loss, bleeding, a change in your bowel habits, and that may be the point in time when that polyp became cancer. So we want to fix it before it actually becomes a problem for you in the future. Next question, are there any after effects? Typically not. Like I said before, we do the procedure. As soon as we're done, you can go home, get some rest, get some good food, and the following day you can go back to normal activities. The vast majority of people do fantastic after colonoscopy. So what are the risks? So like anything in life, there are risks. There are risks whenever I go outside. There are risks when I go to a car. There are risks when I do a procedure. They're pretty minimal, pretty small. The main ones include bleeding, infection, risk from the sedation, and causing a tear in the colon. In the vast majority of us who do this, those risks are typically less than 5%. Very rare, they can happen even to the best of us. Another question I commonly get is, what about Cologuard? The Cologuard is a good test to help find abnormal stool DNA inside your stool. Basically a poop in a box. You poop in a box, take a dump, ship it out to the mailbox. I can't imagine the person who opens up that box every single day. The Cologuard person, it's got to be a terrible job. Now the benefit about a Cologuard is that it does a pretty good, it does an okay job of finding these precancerous lesions or something else going on. There are a couple of concerns that I have. Number one is that there are false positives, meaning you actually have a test that comes back positive when you end up doing the colonoscopy and nothing is found there. Obviously that can cause a lot of stress for patients who are worrying if there's something growing inside their colon. But the more important concern for me are the false negatives, meaning you have a negative test, a normal test, but something actually is growing inside your colon. And because you have this false sense of security, you may not have any other testing done. In addition, the Cologuard is only done once every 3 years, meaning that it's not like once every 10 years like a colonoscopy. Every 3 years, you have to get it done. And just because you have one negative or normal Cologuard test does not mean that you're safe for the rest of your life. And the other thing about the Cologuard is that it's not a test that you can actually do anything with. It just tells you something is going on inside the colon. So you have to do one additional test on top of that. Versus a colonoscopy where at the time when we see a polyp, we can find it, see it, remove it, get it out of there. So another question, famous question, Dr. Islam, what about the prep? The prep is great, not a big deal. No, okay, the prep sucks. I am sorry. I don't know what to say about this. Prep is not good. I will tell you, we've made strides in terms of making the prep easier, though I don't know how much easier it could be because you really are shitting your brains out. But, okay, it sucks. I'm sorry. It's not great, but it is easier than what it used to be. So another common question I get is, hey, Dr. Islam, I think I want to get a colonoscopy. When do I need to start? A couple things you have to realize. Number one, if you are 45 years old without symptoms, that is my recommendation to start screening for a colonoscopy. Age 45, no symptoms, no family history. If you have a family history of colon cancer, the latest you should start is most likely at the age of 35. However, it may be sooner than that depending on which family member was diagnosed and at what age. If you have symptoms, the time to do it is now. By symptoms, anything inside the gut, pain, bleeding, diarrhea, constipation, change in bowel habits, something else you feel like is going on. If you have symptoms, the time is now. Don't wait. And then lastly, what is the best diet to prevent colon cancer? So we know that we're getting more and more studies about how diet plays a role in developing the risk for a lot of gut diseases, especially colon cancer. And we are seeing a diet that's high in inflammation can make things worse for your colon. Specifically, a diet that's high in meat. Red meat or meat in general tends to produce inflammatory bacteria inside your gut. And over time, that inflammation can cause polyps, which in turn can cause cancer as well. So the best diet I'd recommend, I have a video on this I'll put up here, to help prevent your risk from colon cancer is to have more of a plant-based diet. The data is very clear, and I can tell you for my patients, that is what I recommend. Guys, so thank you for watching this video. Let me know in the comments down below what questions you guys have about a colonoscopy. I'll be more than happy to answer those questions. But thank you for watching. Hope you guys have a happy and healthy day. Take care. Hey, if you want to learn more about a colonoscopy, don't forget to click over here where you can get great information from yours truly.